Mastitis is one of the most common and costly health problems for dairy goat producers. It causes inflammation or an infection of the udder due to a variety of different factors. It can result in lower milk production, milk components, longevity in the herd due to early culling, increased treatment and management costs, impacting overall productivity and farm profitability. The goal of this module is to help dairy goat producers understand proactive ways to reduce treatment and costs associated with mastitis. We'll cover the types of mastitis, how to use the California mastitis test, and strategies to manage and prevent mastitis. Various pathogens can cause either contagious or environmental mastitis. Contagious infections are associated with transmission between animals or human to animal. It is important to note that the last two listed on this slide, Staph aureus and Mycoplasma, are highly contagious and are untreatable, making it very costly to the farm, both productively and financially. Environmental infections are directly related to the cleanliness of the environment where the animals are kept, and common organisms like staph, E. coli, Klebsiella, and others are listed on this slide. Viral causes of mastitis like CAE, or caprine arthritis encephalitis, are important to consider in managing mastitis. They tend to present more as hard bag rather than abnormal milk, making their diagnosis and control different than bacterial mastitis. For this presentation, we will only be focusing on bacterial mastitis. When differentiating between clinical and subclinical mastitis, clinical involves changes in milk as the milk appears to be watery, smelly, discolored, and contain clots or flakes. Oftentimes, the doe will have a fever, go off feed, and become depressed, requiring additional supportive care. Clinical mastitis also refers to the physical changes in the udder as the udder becomes swollen, warm, and sometimes painful to touch. In severe cases where the blood supply to the udder is affected, the udder may have a blue discoloration. A culture or serology is needed to identify the type of mastitis for proper treatment and control. Subclinical mastitis is more common, but more difficult to identify as the signs and symptoms are less obvious. The somatic cell count becomes slightly to moderately elevated. You see decreased milk production in subsequent lactations, and often the doe has an asymmetrical or unbalanced udder after freshening. A good first step in managing mastitis is to culture the bulk tank. This will help rule out contagious pathogens, and in particular those highly contagious pathogens like Staph aureus and Mycoplasma. The CMT is a relatively easy and inexpensive test to quickly know if goats have mastitis. When an infection occurs, white blood cells increase in the udder to help fight and stop the spread of infection. The CMT reagent reacts with the milk containing high levels of white blood cells or somatic cells, forming a gel. The greater the number of white blood cells or somatic cells present, the thicker and more gel-like the resulting solution will be. So it's important to note here that the doe very early in lactation or maybe very late in lactation can react to the CMT and form a gel even in the absence of subclinical mastitis. Results during these specific phases of lactation cycle may not always be 100%, and it's recommended that any positive CMT case have additional tests to determine which organisms could be causing the infection, if any. Like I said, the CMT is relatively easy and it's a doe side test. The first step is to discard the first stream of milk. Then fill each cup with milk, about a teaspoon. Then you'll tilt the paddle to discard excess milk until equal volumes of milk are in each well. Next, slowly add an equal amount of the CMT solution, again 1 teaspoon, to each well in the paddle. Then you'll tilt the paddle back until the milk is halfway between the inner and outer circles. Then gently swirl the CMT paddle in a circular motion to homogenize the solution. Results can be observed within 10 seconds and should be read right away, as the reaction may change. If testing more than one doe, it's always recommended to rinse the paddle after each test. To review the step-by-step procedure of how to use the CMT, refer to this full 7-minute video from the Canadian Mastitis Network. For this module, we'll only play the excerpts only to explain how to read and interpret the CMT.
Let's start the interpretation by the negative reaction. Here, the cup contains healthy milk. The mixture remains liquid and homogeneous. When pouring out the paddle, the mixture drips out normally. It should be noted that a trace reaction is often difficult to distinguish from a negative reaction. This is why it will not be shown in this video. And now, score 1 reaction. When rotating the paddle, the mixture swirls in the middle. If the rotating movement is stopped, the liquid covers the bottom of the cup. When pouring a score 1 mixture, it will drip out of the paddle gradually, despite some apparent thickening. Finally, score 2 and score 3 reactions. In this sequence, the cup on the left shows a score 2 reaction, which means that it is clearly positive. During the rotating movement, you can see some gel formation, slightly rounded in the center of the cup. When the rotating movement is stopped, the gel collects at the bottom of the cup. The cup on the right shows a score 3 reaction, which means a strong positive. In this case, you can see a gel formation, sharply rounded in the center of the cup. The gel sticks to the bottom of the cup, but not to the sides. Let's come back to the score 2 mixture. When you pour it out, a gelatinous mass falls out and may leave some liquid in the cup. When you pour out the score 3 mixture, a gelatinous mass also falls out, but without leaving any liquid behind. Because of the qualitative aspect of the test, on-farm results may differ from what you see in the video. The interpretation may also vary slightly from one user to another. This is an estimate and not an exact value. Therefore, when there is a positive reaction, that is, from score 1 to score 3, the number can vary from 400,000 to more than 5 million cells per milliliter. Regardless of the exact number, the important thing is whether the quarter is positive or not.
Ideally, the CMT test should become a routine part of your dairy goat milk quality management program. To get a doe off to a great start in her lactation, CMT a fresh doe within 3 days of kidding. You may need to follow up a few days later to reevaluate the fresh doe as noted earlier, as sometimes early lactation milk may be high. If a doe is CMT positive and ends up being treated with an intramammary antibiotic tube, realize the white blood cells do not disappear as soon as the infection is treated. A follow-up CMT test 4 to 6 weeks later will better determine if the somatic cell count has gone down or if the CMT test has returned back to normal. The same would be true if you're using a DHI information a week after treatment. The somatic cell count may still read really high. However, using the DHI info a month later should be more accurate in determining the somatic cell counts. And as noted earlier, subclinical mastitis will not show visual signs in the milk. So other visual cues may prompt you to use the CMT, such as an unbalanced udder, as they start to develop a chronic infection and half of the udder starts to shrink. 1 to 2 weeks prior to dry off is another good time to use a CMT. If there is a positive CMT, discussions with your veterinarian about selective dry treatment may be advantageous to cure through the dry period. Again, these strategies are dependent on each individual herd, depending on other management practices in place. You'll want to use the CMT for baseline data and follow up with cultures for appropriate treatment strategies, either as a lactating doe or dry doe. When setting up a CMT results action plan, discuss with your herd veterinarian on criteria for your farm to pursue additional sampling or culturing. Some farms get concerned when they get a trace response, while others don't do anything until the animals are scoring a score of 1 or even higher. Whatever that looks like for your farm, involve the veterinarian for appropriate ways and locations to culture and identify pathogens, and then best management practices for antibiotic treatment of the lactating or dry does. How the sample gets collected in terms of getting an accurate analysis of the sample is very important. This is done through aseptic procedures following a normal milking preparation. After wiping off the pre-dip, clean the tip of the teat with an alcohol-soaked swab, avoiding touching the teat ends. Then you'll collect the milk sample into a sterile container labeled with the doe ID and which half of the udder was sampled. This sample should be stored in a cooler for immediate transport to a lab or freeze it for shipping. Once the sample has been collected, attach the milking machine and complete milking as normal. Dairy herd improvement testing and records are beneficial for overall animal identification and record keeping, but it also can be a great evaluation tool for milk production and health of the herd. Testing every 30 to 45 days can help identify who is contributing to the high somatic cell count and offer insight into chronic does or cases of new infections. Remember, one doe can significantly raise the somatic cell count in your herd. To learn more about making the most of your dairy goat records, I encourage you to review our archived webinar that offers tools and tips for using DHI records in dairy goats. The strategies used to manage mastitis will be dependent on the farm's goals. If somatic cell counts become excessively high in a herd, this affects one's ability to ship milk, leaving the producer with no home for the milk, a position no one wants to be in. Having a working relationship with a local veterinarian can help achieve milk quality goals and provides a learning opportunity in other areas of animal health and management. On a day-to-day level, if known animals are highly contagious, a conscious effort to milk those animals last will help in reducing the transmission to those healthy does. And depending on the severity, decisions to put chronic or contagious animals on a do not breed list or a cull or sell list may be beneficial for the overall health of the herd. Considerations may also be made around drying high somatic cell count does off early, dumping that milk, or maybe permanently drying those problem halves off. Again, all strategies that are dependent on the individual herd. Genetic selection is another area that should not be overlooked, as significant changes in quality of udders and healthy animals can really be made through genetic selection, resulting in profitability long term. When you select for udder type, you are ultimately selecting for udder health, such as teat end quality, size and shape, and less milk out time. These traits are highly heritable enough that progress or improvement can be made at an acceptable rate through selection of bucks. So I'd encourage you to review the American Dairy Goat Association webpage to learn more about goat soundness and genetic selection. And finally, all farms should evaluate other areas of the farm that could be leading to an increase in mastitis or somatic cell count. Milking procedures and hygiene play a major role in milk quality, evaluating TN quality and signs of over-milking. Goats let their milk down in waves, so she could be holding her milk in that first half of milking, which could also lead to mastitis if the stress levels are not allowing her to let her milk down. Whereas compared to a cow, she lets the bulk of her milk down in the first release. So those are some things to think about as you're milking those does. Milking maintenance is also another area that should be examined to determine if equipment is adequate and not adding to the problem. An example would be the liners and the number of milkings recommended for those liners before they need to be replaced. Goats don't spend a lot of time in the milking area, so it's important to check out where their housing conditions are and what they're like for the rest of the day. So clean, dry bedding in a well-ventilated facility with access to clean water and fresh feed are just overall critical for care of the goats. Mastitis is a costly and complicated disease, yet much of it can be minimized through routine diagnosis, treatment, and good management. Thanks for viewing this module, and if you'd like to learn more about mastitis management, please reach out to your local herd veterinarian in developing strategies for your farm. You can also contact your local livestock extension specialist who may provide additional resources.